All right, everyone. So welcome to our UPMC Urology Town Hall. Just for a bit of an introduction. Sorry, you guys aren't on camera.
Oh,
I'll let you wave in a second.
oh, that's awkward.
Thank you so much for joining us here. We know that things are a little bit different with COVID and the fact that people can't be here to join us immediately. So we wanted to give you an overview of our program and the ability to ask some questions of some of our residents and from our Assistant Program Director, Dr. Osilko. So without further ado, hi, my name is Andy Quinn. I'm a PGY1. I went to Jefferson for med school. This is Robin Bassan. He was going to be my moderator, but he's also going to be in the panel. He went to University of College London for med school. One of the wonderful opportunities that we have at UPMC to get to know us.
Andy, your slides are not advancing.
Oh, they're not advancing. Oh, well, thank you. Can you see them now?
Yes, I see your picture.
Thank you. That's me. Do you see Robin?
Yep.
Okay, there's Robin. One of the great features we have is the chat with a UPMC urology resident. You can visit our website to book one of these. They're a little video chat, 15 minutes with one of us. We can answer any questions you might have and give you a little bit of a preview of what our residency program is like in a more one-on-one way. For our panel, we have Peyton Scupa, one of our second years, who will be adding our junior perspective. She went to undergrad and med school at Michigan. Her future plans are a little bit undecided, and her hobbies include home improvement, her cats, and her classmates and cohort mates. Next, representing our senior resident perspective is Brian Chun. He went to McGill for undergrad, Wayne State for med school. He's applying to pediatrics residencies, and his hobbies include weightlifting, etc.
Playing hockey too.
And hockey.
Which we have a game tonight.
They had it. Dr. Silko and Brian have a game tonight, but they're joining us here. They're very wonderful. Dr. Osilko is our Associate Program Director. He is our our reconstructive specialist. He also helps with input in all of our mentoring and is a wonderful addition to our program and from a resident's perspective is really helpful and kind and supportive. So we really appreciate it. He likes fly fishing. Dr. Jackman is not here today, unfortunately, because he has a knee surgery, but
He's not here in person, but he's here virtually.
Yeah, not here in person. He is a robotics expert. These are his two daughters. He enjoys a lot of hiking and his puppy. All right, now let's meet our panel visually. And let's get started. So here's our panel. Hi, panel. Now you can wave. Thank you. So I just wanted to start off and see if anybody wanted to talk about a little bit of our program structure. How many residents do we have? How many years are we? Just sort of, you want to answer those basic facts. Oh, and people joining in, feel free to ask questions, either unmute yourself and ask, or feel free to write them in the chat and I will ask our panel. Thank you.
I can start off by saying at Pitt, we are a 6-year program, which is a unique opportunity where we do have 6 months of research built in. We're the only one in the program how we have it set up, or in this in the system. And we are 4 residents a year, so for a total of 24 residents.
Great. Next, maybe our resident panelists could answer one of their favorite things about their program. What's something that you feel like makes Pitt different and as one of your favorite standout things?
So, I mean, I'll get started, but definitely right off the bat, you'll notice that the culture here at Pitt, it's very much focused on making sure that by the time you graduate, you are a good technical surgeon. And that's from the top down. You know, even from our chairman, Dr. Nelson, he sort of preaches when you interview with him and, you know, when you meet with him on a daily basis, when we see him at grand rounds, he's very focused on making sure that all the trainees that graduate from this program are good technical surgeons. And that trickles down from Dr. Nelson being our chairman to Dr. Jackman, our program director, Dr. Risoko, all of our attendings. Even from the senior residents down to the juniors, there's a lot of focus on teaching in the operating room and making sure that your technical skills are very sound. With us being a 6-year program, you also get the additional benefit of having those extra years in your chief year where you're pretty much basically working in the operating room as a junior attendant, especially as a 6-year going to the VA. That is a time where a lot of our graduating residents will look back and tell us, especially ones who go straight to private practice, that's where I really learned how to be, be independent in practice, both in the clinic and in the operating room as well. So that's something that's very unique to Pitt, that focus on surgical training. And that's a big reason why I really enjoyed my time and really put this program at the top of my list.
Yeah. And just piggybacking off what Brian said from the junior perspective, I mean, he said it's top down and it truly is. I mean, there's such a big focus here of getting juniors in the operating room early and just making that a big focus of your training so that, when you're ready to hit those senior years, like you have such a solid foundation because there's a focus on making you clinically excellent very early. And the operating room is obviously a huge part of that as a, surgical residency. So just wanted to piggyback off what you said. I totally agree.
And that's not to say that, all we do is operate and there's no clinic. There is a good, you do need to have that sort of clinical exposure and you do get that. But I think we do a good job of balancing both the clinic and the operating room. So by the time you graduate, there's basically no reservations you have about your training. And we routinely hear from the other fellowship directors and people in private practice who say, oh, where do you guys train? It's like, oh, you trained at Pitt? Like they always train like really good technical surgeons. And we routinely hear that all the time through Dr. Jackman and Dr. Nelson.
Oh, is it my turn? No, but it's difficult to say what makes Pitt unique. I mean, I haven't been anywhere else. But no, a few things I would say is that the program is very open to suggestions and improvements for patients and attendings and residents as a whole in terms of the structure and, for example, getting rid of night flow, changing to getting rid of the core. Right, old core and changing to night flow or changing around the rotations depending on what will be the best exposure for us in terms of the training. And then I think we get a good mix of open, robotic, endo. It can sometimes be overwhelming because there's so much to learn. There's the theory, there's how to work as a resident, how to prepare for practice, endoscopic, laparoscopic, open, robotic. A wise ex-chief once told me that just trust the process. And I think it's structured in such a way as that you just get involved and throw yourself in there and then you'll get to where you need to be at the end.
All right, speaking of a little bit about what you said, Robin, can you talk to what night float is and what our call system is?
Yeah, so night float system was introduced here, 3-4 years ago? Yeah, so I guess Brian and I were we're
the last year to live through the medium night flow.
Yeah.
So the current chief years were the last, I guess, residents to live the old call system.
I think the impetus for change was that with the call system, obviously it's home call, and then there's no post-call day, and people are tired. You're trying to go to the operating room the next day, and I don't know how much you're going to get out of it. You're
going to do the best for the patient. You're going to learn very much. Your motivation is going to be questionable. If you've been up all night taking care of things. So that's why it was changed to the night float. And it's kind of a balance between, because so the structure is 1 month of night float as a 2, and then 2 months as a 3. So obviously during that time, you're not really operating, just basically seeing consults, taking care of things overnight. But then a balance is, I think you get a better operative experience when you are on rotation. Plus, I think it's pretty fun during the night float. You kind of try to figure out things on your own. You're the one on-call person for what, 5-6 hospitals. So keep repeating that for 1 month, 2 months, and you really get to know what is safe, what do you need to ask for help, what are you able to do on your own, how to take care of crazy things that only really happen in the night, like
You'll still go to the operating room. If there are any traumas that come in overnight, anything urgently operative, you're going to be the one going to into the OR.
Mhm.
One thing I'd like to add about the night float, and I know you mentioned it earlier, Andy, was, and I think Robin also mentioned it too, is that this is brought up from the residents. So every year, Steve, Joel, and I will review and discuss with the residents. And our chairman, Dr. Nelson, also sits down with the residents every year just to see what's going on, what do they like about the program, what do they not like about the program, what are some suggestions that they'd like to put in. The night float came directly from resident input as to being applied to our program. So that's a direct input from what residents said they wanted to do, and it's been a great addition, I think. It's from listening from the top down.
Do you think the attendings have noticed a difference?
No.
Yes,
And that's one thing with working with the residents on a daily fashion, is that you do notice that some of the residents tend to be a lot more sharper because you've had the night to sleep, review cases, and you're not coming in from being on call all night into the OR where you're tired. You've had a whole night to rest, review your cases, and get what needs to be done. And you're bright-eyed and bushy-tailed coming into the operating room. It's great to see.
And if I could make a few comments, I'm Maria. I'm one of the current PGY6s, so I'm like the only one who has seen night float and not night float, as I experienced the old call system, which was very different. I do agree. There's a ton of pros and few cons. The one con that we were worried about as we were transitioning was that it wouldn't be a huge operative experience. And it's not as operative as if you were on an operative rotation, obviously, but you certainly get to do torsions and you get to do emergency cases and traumas. But us being a 6-year program, you get more than enough operating. One thing I did want to comment on that is hugely important and that I did not appreciate until my chief year is that our surgical experience is second to none across the nation, especially our open experience. I matched at my #1 program for oncology next year, and I met so many people on the trail that want to go into oncology, and I realized, like, I've literally done myself 40 RRPs, open radical prostatectomies. I did 2 today, actually. You do them with Dr. Nelson. We have 3 attendings that only do open prostates. And I met people on the trail who are very clinically sound, who had never even seen an RRP in their residency experience. And I've done 40. And I'm a new chief, and I know not well, but I could get through an RRP alone if I had to. I could like set up the bookie. I can do an RRP from skin to skin, and that's simply because of the open training in our program. Our open training is second to none. And now that I have a much better appreciation for that, now that I'm literally doing open cases all week, like we had an RPLND on Monday. Last week I did like 2 neobladders. It's really insane. And what Peyton was saying, she's actually she's my current PGY2 at Shadyside. Like with this graduated autonomy, it's no joke. Like our attendings will time us out and like run 2 rooms because they know that their chiefs can do these cases with their 2s. And so I get in there with Peyton does the case and I watch her. If she struggles a little, I let her struggle, I let her learn. And Peyton, no doubt in my mind, is at the level of any PGY3 across the nation because of the surgical opportunities and autonomy that we have at UPMC, which I genuinely didn't get to fully appreciate until seeing where I am now and like meeting all these people on the trail and being like, wow, like you've never done an RP, you've never seen a neobladder. That's insane. I did like 10 neobladders last year. So definitely something to think about is the open experience you get here at UPMC. You certainly get a lot of robotic. I mean, we have 10 attendings who will do like RALPs, but open is what's dying, but you need to be able to do. And I mean, even like Dr. Rosilko, our recon experience, like I can do urethroplasty skin to skin because his volume's so high. And I'm a future oncologist who's like considering my own IPPs and urethroplasties because of Dr. Rosilko. So it's not until this year that I've truly began to really appreciate how lucky I am that I have the training that I have.
Yeah, and as I move into my junior years, I guess that's one thing that I can say just that's so unique about this program is the focus on resident to resident teaching. And I think that it's just so wonderful because not only are these people your friends and the people that you get beers with and the people that you share hard times with and get through struggles with, but it's the people that you feel most comfortable with, that you're in the operating room and you're able to learn from them in an environment that's controlled and supervised, but an environment that you are comfortable and you're willing to take that leap and to, you know, try things that are new. And that's the only way that you learn. And like Maria was saying, let you struggle a little bit. I mean, certainly they're not going to let you do anything unsafe, obviously, but look, being able to struggle with a peer that's supervising you, it's just such a valuable experience. And I think that those moments have, even as a junior resident, have really shaped me, and I think about it often. So, yeah.
And to take that one step further, I mean, with our academic hospitals, you have the advantage of having that close relationship with your attendings and having that great autonomy. But you take that one step further, we have a VA system, a very robust VA system that you go as a PGY 3 and then back as a 5 and 6. And in those 5 and 6 years, you're basically, operating as a junior attending, basically. The attendings are around, they're always available. They'll help you if you catch yourself in a rut. But you're very much, the primary surgeon in those cases. So you take everything you learn at the academic hospitals from your mentors and the other attendings, and you bring it to the table at the VA. And that's where you sort of, take it one step further where you're feeling really independent. So everything sort of comes together at the end, and definitely in your senior years. But I think having the VA and having that resource is very, very important in your training.
And with that too, the training, to go off of Brian talking about the academic centers, we have 6 sites that the residents rotate through. At first, you may think that might be overwhelming, but when you look at it, there's 6 separate individual experiences that the residents get to go through. Starting at Mercy, which is where my home base is. It's a real big reconstruction, prosthetics, oncology, and you have just general urology. So the residents, you have a chief and you have 2 juniors. Then we go up the hill to McGee, which is our women's hospital, which is just strong. That's going to be your infertility and female urology experience. Across the street from there, which all these hospitals are about 1 mile apart, so it's pretty close. You have Presbyterian, which is major trauma, oncology, robotics, and stones. Down the road from there, you have Shadyside, which is stones and oncology. Up the hill, you have the VA, which is general everything. And it's a great experience. And then across the street from there, you have children's. So you have a good experience throughout 6 different, completely different institutes that you're going to be working throughout your 6 years.
Yeah, thank you all for your wonderful comments and like thoughts about, how our operative experience is really amazing and diverse. I was wondering if Dr. Rosilko, you could speak a little bit to, like, now that we have this training, what do you see residents do when they graduate? Like, what are people going into private practice versus fellowships? And, how do you think residents are able to succeed once they leave?
That's a great question. It's one that we do pride ourselves in, the education at Pitt. So we do have residents who come through and from day one want to become the best private practice general urologists. They go out, day one practice, They're out doing urethroplasties, open prostates, bladders, kidneys, everything. So we do have residents who go into private practice. We do have residents who want to go into high flow academics, where they'll go do their fellowships. And most residents here do end up getting the first or second choice of fellowships. As we just talked to Dr. Perret, getting her first fellowship choice, and that happens a lot, especially with the amount of academics and surgical exposure you have. You're a very hot commodity when it comes to looking at the fellowships from the fellowships around the country. So you can come here and really mold yourself into what you want to do. Do you want to be a subspecialist fellowship trained? Do you want to be an academic? Do you want to be a private practice? You can really get anything out of this program coming from here, both operative, academic, research-wise. World is your oyster.
Great. I think something else people are curious about, knowing this is like, what is mentorship like at UPMC? What formal and informal mentoring opportunities exist here?
All right. That's something that has changed over the past couple decades, where traditionally, and I came from a program where traditionally mentorship was an academic, faculty and resident. We used to have that, but with the open door policy that we have at Pitt, really, once the residents decide on what they're interested in, we have subspecialty fellowship trained attendings in every field. The residents just basically approach and you start working on projects with them. Example, Robin has shown interest in reconstruction just since he started his research year or research 6 months last year, and already I think he's had 5 publications, I think 10,000 abstracts. I mean, we had to cut him off on going to conferences because everything he submitted got accepted. And so those are things where over time and being exposed through your intern, your junior years, you get your interest and you just approach the attendings that you want to go into and get you there. So when we talk about a mentorship with faculty and a resident, you get to pick who you want to be mentoring with. But what we've designed here, and I really love seeing it, I know we just had the dinner last night where the chiefs meet their interns. We have a mentorship that's in the residency itself, where how it's run is we pair up a 5 with an intern. And so you're mentoring with each other for 2 full years. So that first year and second year, you have a chief resident who can sit there. If you have problems on a call, you have questions, what do you do about this? How do I submit an abstract? How do I do a manuscript? You have a chief level resident who's there. And sometimes it's a lot easier for a resident to ask another resident compared to a resident, especially an early resident, asking a faculty member. So our mentorship that we've really designed here is resident to resident. But again, we do have faculty resident mentorship that's an open door.
Yeah, I think that's one of the really wonderful things that I don't think I quite realized, but like having a senior resident who can act as a mentor. My mentor is Robin, who can answer any questions you might have or things like that is really helpful. But they also really develop very naturally. I think we all are super supportive here. And speaking of resident support, I guess I'm curious to hear your opinion, Brian and Peyton. You know, how do you feel like you're supported in such a large program when there are 24 of us? And, you know, what are the benefits and drawbacks of being in such a big residency program?
It's so funny that you say such a large program because I feel like there's so few of us compared to like an internal medicine residency or something. But
Have more than 24.
yeah, exactly. There's like 50. But I truly feel like I have a relationship with every single, like a personal relationship with every single resident in this program. And I think it's top down. Like as an intern, I remember like you are part of the crew, like you are always involved, like your chiefs are invested in you, the attendings are invested in you, like it's, you are so involved from such an early age. And I just felt like when I got here, I was just immediately accepted. And I felt like everyone just wanted to get to know me. And then that leads you to feel more comfortable exploring relationships. And, you know, when you think, oh, I'm the intern, they're the chief, whatever. But truly, like, as an intern, like you're forming such close relationship with your chiefs where you can literally go to them about anything. And I have, and, you know, and it's just the culture that we have, and the resident to resident relationships are just, and I know everybody says that, but it's just the truth. Like I just feel like this program is exceptional in that way. And I feel like I just wouldn't have it any other way.
Yeah, I think, you know, our program being 24 people, you know, 24 residents in total puts us at the, you know, at the larger side in terms of programs. But I think it's interesting because we do have like quite a few sites that we need to cover. We have about 6 hospitals that we need to cover. So even though there's 24 of us, on a day-to-day basis, you might be working with a group of 4 residents at Shadyside, which is our biggest team, sometimes 2 or 3 per team at each hospital. So you do have that close relationship with the people that you work up with on a daily basis. But every Wednesday, we still have grand rounds in person. We all meet together. We all get breakfast and coffee together and chat in between, you know, our 2 hours of education. And then you can definitely tell, like, you know, everyone is very collegial and gets along with each other, even though, you know, we're all very diverse, which is, I think, a very strong, you know, something that's really strong and unique. That, you know, people are coming from all different backgrounds. We joke that we're the most international urology residency program in the country because Robin's from the UK, I'm from Canada, Maria's from Ecuador, and Valentina, who just graduated, was from Colombia. I mean, we were covering all 4 corners of the world. So we definitely have a good breadth of diversity within our residency. But we have that, you know, you have a lot of us, so you can, you know, find people with different interests, but then you also have that close-knit group within your own hospital.
And you really do get close with the people that you're working with on an everyday basis. I mean, you're working hard, we're learning a lot. And those people, like having that core group of people, and, you know, we do our rotations for 3 months at a time, which I think is really nice actually, because it allows you to get into a rhythm and do some of the same cases over again, but also get into a rhythm with your own team. And, you know, it's always sad when you're leaving your team because you feel like it's like the end of an era, and you've gotten along so well with those people, and, you know, you're going to miss them, but then you get a new team and it's just as great. So that's something that I really like about this program.
Yeah, I agree. Switching gears a little bit, I was wondering if anyone would like to comment on Pittsburgh, this great city that we will spend many years in and enjoy a lot. People, not many people are familiar with Pittsburgh, so give us your thoughts and a quick virtual tour.
Pittsburgh's great. It's no, because I just got my Steelers scrub can. So it's finally everything's coming together.
Cheap year.
Yeah, I think it's the perfect place to do a residency because the size, it has all the amenities that you need in terms of the city and things to do and restaurants. There's a 3 sports teams, no basketball team.
No basketball.
It's too hilly.
It's too hilly for basketball.
The ball just roll, try and bounce it.
Right, because people play basketball on the streets.
And you have one flight here in London.
Yeah.
British Air's direct flight Pittsburgh to
Exactly,
London.
Pittsburgh
daily.
International Airport. So yeah, silly things like traffic is not too bad. You know, driving around on call, it's very doable. Cost of living is lower than in all the bigger metropolitan areas. People, a lot of my friends have bought houses even in intern year, and they save a lot on rent, things like that. So it's a very livable city, but still with big city amenities. It's like what do you call the museums and all that kind of stuff. I think there's a great infrastructure built up from the history of Pittsburgh with the Carnegie museums and the Mellon family. So
and the university as well is such a big part of the city and plays a big part in, you know, all this that we do.
Multiple universities, being staff residents, you do have access to all of the resources from the University of Pittsburgh, as well as you have access to the resources to Carnegie Mellon. So if you have interest in doing any projects with Carnegie Mellon or University of Pittsburgh, you do. I know myself and a couple of residents are working on projects with both University of Pittsburgh and Carnegie Mellon, which are 2 excellent institutes to have availability for you here in Pittsburgh.
Yeah.
Now it's because, isn't Pittsburgh becoming like a big tech hub now?
Yeah.
I think one of our patients told us that, what was it, New York and then LA
And then Pittsburgh.
and then Pittsburgh in terms of Google and Facebook.
Google, Facebook, Amazon, Uber.
All of them have their own
Duolingo.
campuses.
Yeah, so it actually is a pretty big tech-centered city. And again, that goes back to the University of Pittsburgh and Carnegie, which has helped bring the resources for the tech industry to town. So I know in past years, we've had several residents and their significant others who would work with Google or Amazon, who it was a nice, attraction for matching in Pittsburgh because the partners are working with Google or Amazon, and this is a major hub where a lot of jobs are available for the tech industry.
It's very safe. It's a safe city. Yeah, I've never really felt unsafe. People have told me that, oh, you shouldn't work in that place, but even then it was still fine. Later. Sometimes we find ourselves late at
Especially
night walking
compared to
around
North,
places.
yeah.
Exactly.
But I'll say myself, I'm actually born and raised in Pittsburgh, moved away and then moved back. There's a lot of people who do find themselves coming back to this city for a reason. It's a very family friendly. It's a young city, and there's a lot of things to do here. I was practicing in Washington, D.C. prior to coming here, and the cost of living was peanuts compared to what it was in one of the more major metropolitan areas for housing, for food, for access and everything. That's one thing that the residents don't have to worry about. You get free food, free parking, which is great. We were
Yeah.
talking about it at lunch the other day.
Huge, like literally huge. Can I just tell you?
Yeah. Basically free, unlimited.
Yeah.
Yeah.
And then
We used to get like 3 pieces of cake for lunch.
we did.
Yeah.
I mean, UPMC is pretty generous in terms of like resident salary, especially when you factor in
The cost of,
living
oh,
in
for
Pittsburgh.
sure, yeah.
It's very affordable here. Like Ron was saying, has all the amenities that you would want in like a big city. If you're a sports fan, obviously, you're gonna watch the Steelers, the Pens, and the Pirates.
If you're a golfer,
Yeah, there's good golf.
good golf course,
You go,
good driving ranges.
The benefits of research.
Exactly.
You guys had your golf.
Yeah.
But then you had
And
your
then
skiing
isn't
membership
the
outside.
US Open is gonna come
Yeah,
back.
US Open in golf is there in Oakmont in 2025.
Oakmont has had, next to the Masters and Augusta, has held the most majors
Is that right?
for golfing, and that's 10 miles up the road from it.
Fortunately, there's no one in our program with a membership to Oakmont.
I'm trying to work on
Yeah.
it, Dr. Nelson.
But we do, I know some people who's like dads are members. That's really the way to get it.
Not within our.
And if you like outdoors, it's a very unique situation where we are because you do have all 4 seasons. And as Robin and Brian were talking, I know they did some golfing during research, which yes, they were able to get golf memberships.
It's like a trend now on research. You just pick up golf.
But I also know you guys got ski memberships too, and within the area, if you like winter sports, we have, I think, 7 or 8 major ski areas within 3-hour drive.
Brian is like an amazing skier.
So you do have outside activities.
Okay, I feel like we've talked about how great Pittsburgh is for quite long enough. So can we move on to, like, you guys were talking about swag. UPMC really supports us, like loops, white coats. Can you guys comment on that? Because it's really clutch here.
Yeah,
Oh.
loops,
Yeah,
so
loops.
loops are included as an intern now, you
Yeah.
get your loops.
Dr. Rosilko was the one that was like making the push for that. And I remember you telling me about that because as an intern, when you're doing urethroplasties with Dr. Rosilko at Mercy, you'll be harvesting the buccal graft as an intern. And Dr. Rosilko was like, no, like we need to get everyone needs to get loops like intern year because they need them when they're on their reconstruction, rotation at Mercy. I just thought that was so huge to like, as an intern, like you're operating with loops. Like, I just thought that was like so awesome. And you get to pick your frame and your color.
You get fitted.
Yeah, and it's very fun. I loved it.
What else we get? Loops, we get an
Yes.
I get an iPad. You get,
Meal tickets.
you get,
Unlimited
you get a
meal
copy of,
tickets.
Campbell's, either.
Jacket.
Electronic or
You-
paper
you
copy.
Patagonia jacket.
Oh, we love our jackets.
Free parking.
Oh, the parking is huge.
Yeah.
Like we have great parking. And I mean, for, when we're on call, you're on night float and stuff, you have to drive around. And so you literally just you're like in and you can use the parking whenever you want. whenever.
Something I didn't realize until I talked to like residents in other programs is that like we don't pay for like
Oh, yeah,
health
we are.
insurance,
Yeah.
which it blows my mind that
Yeah,
some
that's crazy.
some residencies don't cover that.
Yeah.
So you get the UPMC health insurance, which is very good. And if you have family, your family will have good coverage as well.
Mm.
So little things like that. I think we're getting led
Yeah,
as well.
we're getting lead. We're getting lead for everyone. So that's new this year from resident request. So that was something that Dr. Nelson decided to go forward with when we had our resident discussions. One thing I'd like to talk about the program and what I am excited about what we offer is I do a lot of international lecturing and operating. So, and several of my other partners do too. We have a big contingent that work with IVU, or International Volunteers in Urology. So at all times, we have faculty that are traveling international, whether it's South America. My partner and I, Dr. Taryn, is oncology. We go to Thailand every year. We take residents with us. The pediatric group go to Africa several times a year. So when you're on research, you get to go to Africa, or you can go to Thailand. I go to India every other year. So we do take residents with us, which is kind of, I think, pretty cool. Most residencies don't take you international.
Amazing.
Secondly, when you get, for academics, if you strive and you go out and you get abstracts or podiums or posters accepted at conferences, we'll send you there. And so that's something where we really strive on the academic production from the residents. So if you work hard and you get something accepted at a conference, we're going to send you there.
Sure, I'm going to Thailand this December. I'm really excited. We're going for 9 days, and it counts as like a presentation because I'm giving a presentation there, and the department funds it. They paid for my ticket of an undisclosed amount, which is not cheap. They pay for my hotel, and then like Dr. Taryn, while he's there, he and Dr. Roselko, they pay for your dinners, and it's like a free trip to go and like be educated and help like people and learn about surgery. It's really incredible.
It's nice seeing medicine and surgery outside the box, which I think is a priceless experience for residents to see. With training in what surgical and education is outside of this country.
I think that, we mentioned it a little bit, but can you guys talk a little bit about the research opportunities here? What are some of our formal, like more lab-based research options, and then what are our less formal or maybe still formal, but not lab-based options for research?
Brian, this just went through.
Yeah.
Yeah, so Robin and I are just coming off the heels of research. So your 6 months of research is in your PGY 4-year, either the first or second half. So Robin and I did it the second half of our 4th year. So you really have, it's pretty flexible, but there are 2 sort of established tracks that people tend to gravitate towards. One is the basic science lab. We call it the CAT lab, where you're doing experimentations on cats, mostly looking at bladder neuromodulation. That is very flexible in terms of like your schedule. You have very distinct timelines when you need to be in the wet lab and all that. And you can be productive even with a basic science project. The other option, which both me and Robin did, was working with our oncology research group. We have a very established urology health services research division, which is a formal division within the University of Pittsburgh School of Medicine. And basically it is looking at sort of health services within urology, and it's sort of backed by Dr. Jacobs and Dr. Davies, who are our 2 oncology staff at Shadyside Hospital. So that's a little bit more regimented, more database driven. So pros are it's a lot more computer work. You can work at home remotely, but there's a little bit more regimented meetings. You learn a lot about how to draft manuscripts, submit things for submission, working on grants, getting that sort of mentorship from Dr. Jacobs, especially on that side of your academic career, is very valuable. So a lot of residents do tend to go to that track. If you have other interests that don't really fall within those 2, our program is pretty, is very accommodating. I know some former chief residents did work, outside of UPMC, worked with, I think, UNC do some collaborative research on geriatric urology projects relating to geriatrics, and was very productive with that. So don't feel like you're boxed into one of these two tracks. If you have an interest, and again, you can leverage the University of Pittsburgh or CMU with some of these projects, then it's really up to you, and the program will support that.
Something that I became very concerned about when I applied, that we all had to do basic science research. So in learning more about the program, it's something that I found was really flexible and really allowed people to get involved in whatever they were interested in, with some also like already established tracks that gave you lots of options to jump in or to start your own project, which I think is really exciting to have that flexibility. Maria?
Yeah, no, it's really true. Like, just to say what Brian said, like the program fully supports you. Like, I did HSR, but I have published with Taryn on cystectomies because he's like my oncology mentor. I've published with Dr. Rosilko on recon just because we have such a robust experience with it. I've published with Simmons on stones just because I had a great rotation with her and I had an interest in like these like what these litholinks showed and what they showed in athletes. And so you can really just like get involved in and have all the support you need in any aspect of it, whether it's HSR, whether it's basic science. And I echo what Andy says, like basic science makes me personally want to vomit, but I really appreciate all the doctors out there that do that because that's what changes medicine and is like the future of medicine. And you don't like, we have people who publish the 4 minimum papers, people who publish 10, and we have people who publish 45 papers, like the Avi Magantis and Katie Tysons of our program. So you can be as academic or as little academic as you want. And just like Brian said earlier, this program fully supports you if you want to go into private practice from day one, or if you want to go into academics. And that's something super unique. And to be honest, I don't know anything about our program, but our program is super supportive of like whatever you want to do. And it's been really refreshing as someone who does not like basic science.
Yeah, I think so. We've discussed a lot about how many opportunities our program has, how we have a huge exposure into things like open and recon, and all of these different areas. But I'm curious if you guys have any thoughts on what are some areas that we don't, like you wish we had a little bit more exposure to, that like might give people an insight into that.
Yeah, I mean, I want in terms of the subspecialties, some people have questioned the number of female cases and opportunities for female urology that we have in our female urology department. But a caveat to that is that the urogyne and gynecology department is excellent, and we work very closely with them as well. So people from our program have gone into female urology fellowships for like their first choice, and they have done plenty of clinical and research work with the urogyne people as well. So the two departments, urogyne and female, are kind of pretty much linked in terms of they work together, do cases together. So I don't know if some people have heard about the female urology experience, but personally, I had a great that's based in McGee. Is where we do most of those cases, and we far exceed the minimum case numbers as well. And so, like I say, we've had multiple residents go into female urology from here. So
We've had 2 in the last 4 years, NYU and Beaumont. And we do have structured for the rotation during your 4th year. You do spend 3 months, every day of the 3 months, you're on female rotation, whether you're with our female urologist or you're with urogyne. It's split throughout the week, but every day of the week for 3 months, you're on female urology rotation.
And that's new to this year because like Robin said, historically people like our downside is our female, like we only have a great female urologist, but we only have one of them. And so we've really joined, like Christian put a great question in the chat. Can you comment on any upcoming new additions or changes to faculty or rotation sites? And like, yeah, we definitely can, because we used to be 4-3, 4-3, 4-3 as far as residents, but then we were accepted to 4-4, 4-4. So this is the first year we've had 8 chiefs. So everything is changing a little, and for the better. We have 8 chiefs, so we need new sites and like new. So what we're trying to do is fix our weakness, which Robin just pointed out is female. So what we've done is put a new McGee chief at McGee so that the 4, instead of being split between our great Huang experience and Shermansky experience and some endourology with Dr. Oy, is strictly female. Like Dr. Rosilko has just pointed out, they're in Urogyn or they're in our Urogyn cases, and they're just female all week. And not just that, we now have 8 chiefs. So we're really interested in looking at like private practice, which we don't have a lot of experience with. We're throwing that 8 chief either into St. Margaret's or Passivant. All of these are up and coming talks. And I mean, to be honest, we have such a breadth. I was talking to Dr. Bigley, who's one of our endourologists, like superstars, about his experience when he was a resident. He's like, Maria, I lugged 1 urethroplasty. And I'm like, I am going into oncology and I've lugged 40 urethroplasties because of Dr. Rosilko. I've lugged 20 VVs because of Dr. Huang, which is more than some fellows do across the nation. So the breadth of urology you get here is like second to none, but we are looking at adding other sites to add private practice because that's something we've never had, but we're lucky to have the volume and resonance to try to add, because Dr. Rosilko is the one who always gives us the talks on CPT codes and how to bill and what private practice is like and how do you keep the lights on. And those are talks you don't get in residency, but that we've addressed, in our attendings do a great job of listening to us and acclimating to our input. And so there's a lot of good change coming, although it's hard to get perfect from great, but thankfully we're great trying to be perfect.
I will, yes, I agree with what Maria says, that like our program is always looking to fill deficiencies and to improve our experience. They're always listening to what we're saying. Do you have any additional thoughts on like changes we're making to the faculty or rotation sites or the program in general?
I'll just echo is what everyone said. I mean, right now it's exciting because we've gone now to a straight block 4, where we've picked up the extra chief, and there's so many opportunities with what we can do with an extra chief, because at the chief level you really are, you're a sponge. You absorb everything, you learn everything. So private practice, coding, billing, recon, infertility, all these subspecialties, and general practice we're adding in, which is a great exposure. And that's something that we've heard from past chiefs, but we didn't have the availability to do it, but now we do.
Dr. Jackman, do you have any insight on that? I know you're very good at answering this question. Are you there?
See if I can unmute myself.
You're unmuted.
I am unmuted. I think one thing I was going to say that's new it really is more about the process of the interviews. I thought would be useful to share, and that is that we're going and discussing, the possibility of second looks, which are really kind of first looks, because one thing that people are concerned about with respect to where am I going to fit in, how am I going to work with the residents, how am I going to interact with them, is I can't get that on a virtual interview. So we're actually going back to something we got rid of long ago, coming back for a second time, a second look. Now we're making it really a second look as a first look, and allowing applicants to come to programs after their lists have been submitted. So there's no kind of, they're not trying to, be nervous or impress anybody, but they can actually just come and talk to residents. And I think different programs are going to be hosting this in different ways. This is the first year we'll do it, and I think some programs will do it. The problem, of course, is that there's a very compressed period of time between when we finish our list, which is we always do at the very end of our as soon as our interviews are done, we put our list in. But there's a somewhat compressed period of time between, kind of mid-December when that happens and early January when the applicants' lists are due. And so the middle of winter and the holidays makes some challenges. But we're gonna figure out a couple options for people if they wanted to come to Pittsburgh, meet the residents, even shadow some. I think after they finish interviewing, if they need that extra information to help them decide where am I going to fit in best, where am I going to learn the best, so I'm kind of excited about that being a new little addition to the process.
Excellent. Thank you, Dr. Jackman, for your input and for joining us, even though you couldn't be here in person. I have, as we sort of wrap up the evening, I have a sort of silly question to end things on that I think will sort of help people get the sense of what our program is like. And I just want you guys to comment on the vibes. What are our department vibes? You know, give us your thoughts.
I agree that it's a silly question.
Well, I guess what I will say, I don't know if this is like a vibe, but my capstone statement is what UPMC is about is you're going to work, but this program is going to get you wherever you want to be. If you can dream it, you can do it at UPMC, and you're going to do it with your best friends. I mean, it's true. I like literally love these people like so much. Like all my co-residents will tell you how much I tell them I love them every day. And it's just such a unique experience to have a place where you're surrounded by people that you like and that are your friends, but then you have this incredible surgical training, which is just, it's everything you could ever want. So that's my vibes statement.
Yeah, I mean, I think Pittsburgh as a city culturally is very like blue collar, and I think some of that comes into like UPMC in general. But I remember when I was applying and I was like looking up on like Doximity and looking at like comments that like recent alumni had said about the UPMC program. And I remember there was like this one comment that said like, come to UPMC, brilliant doctors surround you and you'll be inspired for life, something along those lines. But I mean, basically the bottom line is that at UPMC, all the specialties, they're like ranked within the top 10 of the country. You know, especially the surgical specialties are very, very strong here. And those are the people that you're going to be working with, you know, beyond our program on a day-to-day basis in the hospital. So you're going to be surrounded by very smart people, very smart clinicians, very gifted surgeons outside of urology, and within the department itself, very strong, you know, residents, attendings, and you know, and leadership. So that sort of culture is going to be pervasive throughout your training, and that's going to really shape you as a resident, as you're training, and you're going to carry with that when you graduate. I mean, I was just looking at our Twitter, and like we have all these alumni that keep like harkening back to like, oh, like thanking Dr. Nelson of all those like open prostates that they did with him and how they shaped them as attendings, and they're like 20 years out into practice and still looking back fondly about their training that they got here. So I think that in itself should speak volumes about that.
Yeah, I think the vibe is great. No, overall, so no, in general, I think there's an excellent structure. The program has a very well thought out structure, but within that, there's no hierarchy, stuffiness, or worried about rules. I think that the main thing is that if you keep a focus on the patient, and if you just make sure everything you do is for the best thing for the patient, then everything else really works out, and you can get to that however way you want to do it. But yeah, you know, people are very approachable, and it's an easy place to work. I think the vibe of Pittsburgh is whatever you know. Welcome to come and hang out with us and see how you find it.
Yeah.
But,
We'd love to have you.
All
Yeah,
right.
and sorry, and if I can just like echo on what they're saying, like vibes, like you guys, there's a lot of different things you're going to be asked, and like looking, like, are you looking for academics? Are you looking to research? Are you looking to be a PhD? But I think our surgical experience is second to none, but our camaraderie is genuinely second to none. Like Peyton is a PGY2 and I'm a PGY6, right? Like I'm graduating, she's a 2, but I can tell you right now, her brother's names, her cat was just sick. She just lost a cat. Like she's upset about that. What her parents did last week. Like I can tell you that because I go to work and I care about Peyton's well-being and her future. And obviously I care about like her surgical, like we were in the OR together, like doing all sorts of things, but she had a rough day. I take her out for a beer. I'm her chief. It's no big deal. Like we talk like we're sisters. And that is true across the board. And so if you want to go somewhere, you're like really support, not just that, like I text Jackman literally daily. Dr. Rosilko gets phone calls from me like twice a week, and he answers them. He's like, hey, good doctor, what can I do for you? And it's an open door policy with all of our attendings. Nelson's a little more formal, and he literally just gave me Pittsburgh Saints tickets because I went to LSU for medical school. So like, if you want to go somewhere where you genuinely have the full support, open door policies with your attendings, like you can talk to them about anything in your life, get their full support, get the #1 job in the world, and be genuine best friends with your co-residents, this is the place to be. And I appreciate that not everyone appreciates that, right? Like some people don't give a shit about their relationships with their colleagues or their attendings. They want to go to the Johns Hopkins and be chairs, that's fine. But if you want to go somewhere where you have surgical excellence, academic excellence, excellent research opportunities, and exceptional relationships with your attendings and your residents, if that matters to you, this is certainly a place that I think is probably second to none.
I agree. I want to thank everyone who joined us this evening. I hope that you got a small sense of what our program is like. It's incredibly wonderful, to say the least. I would really like to thank all of our panelists, Robin, Brian, Peyton, Dr. Asilko, Maria, and Dr. Jackman joining virtually. Thank you all. If you have any additional questions, you're welcome to ask them in the chat right now, or you're welcome to schedule a Meet the Resident thing. And this will also be available online. And we're always reachable by means online on Instagram and Twitter. Feel free to reach out. Our residents manage those accounts, so we're always available. And we really appreciate you coming here and appreciate your interest in our program. Thank you so much. All right. We'll stay on for a couple extra seconds in case there are any questions. Other than that, have a good evening and bye all.
I say in the words of Peyton, if you can dream it, you can do it.
It's true.
Can we put that on like our Twitter page?
Can we put that on the website?
Yeah.
Oh,
Why don't you put the link up for the resident talks for a second or two? So
How many people? They're like
It's gonna be recorded.
it's recorded. So
It's gonna be recorded and posted.
we posted a little bit late. I think last year we put it a couple weeks in advance. I think we had maybe at one point. Yeah, but it's posted. So
I'm going to mute us. All right, guys. If you have any questions, let us know.